Pregnancy is generally considered a period of emotional well-being for the mother and for the family. And sometimes this expectation that pregnancy has to be all happy and wonderful could set a stage up for the mother to feel alone when she's feeling very normal changes to her mood and emotions during the postpartum period. Up to 85% of women and mothers experience what we call postpartum blues. What are postpartum blues? There are changes that a mother experiences after the delivery period where there's changes to her sleep, to her appetite, to her mood, to her worries, to her concentration, and to her memory. It usually begins around 3 to 4 days after the delivery, and it peaks around 5 to 6 days. And it usually subsides around 10 days or so. So within 2 to 3 weeks, the mother kind of has more stability with her appetite, with her mood, as well as with her sleep. During this period, it's very important to keep in mind that what's really helpful is reassurance from others that these changes in emotions are quite normal, and to seek supports to make sure that you're not doing things alone. What is also really, really important to keep in mind is that sleep could be very protective around this time when there's so many changes, understandably so, to the body and to the mind. And so making sure that you could try to get someone to help with the feet so that you could get at least 5 hours of continuous sleep would actually go a really long way. And being mindful that sometimes the division of labor might be unequal during the postpartum period, and seeking the support and talking to family, friends, and your partner about how you're feeling could go a really long way to help manage and cope with some of the postpartum blues that is very, very common. Usually it's mild and it doesn't interfere with the mother's ability to take care of herself as well as the baby. There are at times mothers that are at risk for postpartum depression, and some of the risk factors for that is if there is a complicated pregnancy, a complicated delivery, if there's a past history of mood and anxiety disorders in the mother, if there is relationship problems in the relationship, if there's social isolation and few supports, and if there's significantly disrupted sleep. So in these situations, sometimes the mother might experience more than postpartum blues and might experience postpartum depression, which is really important to identify and support as well. And Dr. Thangarasa will now talk a little bit about postpartum depression.